You're listening to CDKL5 in color. I'm Marissa, and on this podcast, I'm joined by my co host Amanda and sometimes some very special guests to talk all things CDKL5 Deficiency Disorder. It's a rare genetic condition caused by changes in the CDKL5 gene. Patients with this condition often experience profound developmental disabilities, difficult to control seizures that start in infancy, cortical visual impairment, and a variety of other health concerns. It's a challenging condition, but we know that by sharing our stories, we can raise awareness, provide support, and paint pictures of our community that can lead to greater understanding and meaningful change for families like ours. Let's jump right in.
Hi, Amanda.
Hey, Marissa.
How are you?
Things are good in Colorado. How about you?
We're doing good. We're doing good in Connecticut. Today, we're going to talk about a topic that I would say comes up relatively frequently in our Facebook support group, which is constipation.
Yeah, no doubt. I think it's actually one of the more challenging diagnoses once people are aware that they actually are dealing with GI problems.
Yeah. No, it's a struggle for sure. And I think there's lots of different approaches people have to managing it and some different things that can happen. So I think it's a good conversation for us to have. I think we should put a disclaimer out to say the things that we share in the episode are really for you to take back to talk with your doctor about.
Yeah. I mean, poo is quite an interesting topic for a lot of reasons, and it sometimes has a stigma that you have to, whatever we say today, take it or leave it, but don't take it and try to implement it without talking to your doctor. You don't want to be doing things to your child that could hurt them, and I would just say don't do anything to your child you wouldn't want someone doing to you. So be sure to have a good, frank conversation with your doctor. And they've heard, GI doctors have heard it all. So there's no shame. They probably have some good jokes or some funny poop charts to show you. So just be sure to have a very frank conversation and get a plan in place for your child.
Yeah. I think sometimes we forget to do that. We go to the GI doctor, we're talking about feeding, maybe tube feeding. That's a lot of what we talk about when we go to the GI doctor. We talk about bowel habits. But sometimes if my son is going every day, I still don't realize that he might be having some struggles with constipation. I don't always share everything about his bowel habits because I think maybe it's not relevant, and it's something that I'm going to get better at doing, is making sure I'm painting the whole picture of what we manage.
Yeah. I think they have a lot of tricks that, first let's try our frontline laxatives and treating reflux, those kinds of things, laxatives and antacids. But if things still aren't working and your kiddo's still full of poop, it's not really comfortable for them. And it likely drives some behaviors that you might not even associate with it.
Some people in our group also mentioned increased seizures when constipation and other GI issues are really prominent. Yeah. So that's something to be aware of too.
Yeah. And have little ones and you aren't paying attention to reflux or treating it. That was sort of the beginning of our feeding challenges. If your throat is on fire from acid coming up all night, you kind of stop swallowing anything, even fluids, which really can snowball.
Yeah. Well, what does that have to do with constipation, reflux, and constipation?
Well, when we think about our kiddos and the challenges they face with motor neurons in general, and all the medicines they take, our whole digestive system, it works off of movement. Once that stuff once it stops moving, all kinds of things happen. Reflux and constipation are sort of the same thing, only at a different end of your body. And motility and how our bowels move things through our body, things can come out your mouth or things can come out your bottom. So you really need to be aware if things are not moving out of a stomach and down.
I think I heard someone say, it was probably a nutritionist, it might have been a doctor, say that digestion starts in your mouth with your chewing and your feeding. And we personally didn't struggle with constipation with my son until he got a feeding tube. We switched to tube feeding. I kept him on the same diet that he had oral eating because he was only eating purees, so you're blending purees, and then to blend those purees for tube feeding was a matter of adding more water and blending it for longer. So he really was on a very similar diet. when he switched to tube feeding. He was fed through a G tube for about 8 months. And then it was a really terrible time of his life where we were having a lot of struggles with his seizures, a lot of respiratory issues. And one of the solutions that the team came up with was to try and switch and get his feeding into the J, into the jejunum instead of in the G, into his stomach. So we made that switch and he started on a continuous feed in the jejunum. So his feeding tube, instead of emptying food into his stomach, it snakes down a little bit further into the small intestine and it dumps the food. It lets the food out into the small intestine. So my son never has anything in his stomach. Well, except his medicine. We do give his medicine in his stomach. It's interesting because the J feeds dump in the jejunum, which is below the area of the body that absorbs iron. So I guess in a circular way, I'm trying to explain that he started having the J feeds and then he was lower iron because all of those iron-rich foods and things were not getting dumped into the system where they needed to go to get absorbed. So he started on an iron supplement. And really, when we started the iron supplement, that's when we started having trouble with constipation. So it really wasn't an issue for us the first couple of years of his life. He started with J feeds when he was almost 4. So it was around then when we started having issues with the constipation. And when I would talk to his GI doctor about it, they suggested using Miralax. And for a while, we were doing daily Miralax. And then I noticed when my son would get ill with like a respiratory infection and be on antibiotics, his pediatrician would recommend giving him a probiotic. I used to give him the probiotic for like a month after the antibiotic was over until there were no more in the box. And after having that happen 3 or 4 times and realizing, wow, the entire month he's on probiotic, I haven't had to use any Miralax, it finally clued me in to say, well, geez, maybe if I continued with a daily probiotic, I wouldn't have to use the Miralax. And that has been the case. So we've been able to use a daily probiotic and get off of using the daily Miralax. We still do use Miralax as needed. Things are a little more firm than I want them to be, or he's gone 24 hours without going, then I'll bring out the Miralax and I just stay on top of it. Because when he was first diagnosed with CDKL5, on the IFCR website, I had the clinical care guide that was from like 2009 or something. It's old, right? I had it printed out and I would read it like obsessively. I would bring it everywhere I went. This is just how I do things. And I remember it had that section on GI and it had some potential like significant health challenges that could come about if your like constipation was untreated or if were having issues with your bowel. And that always freaked me out. So I've always been really on top of what his bowels look like. And actually it's funny because in my household, if I'm Gregory's primary caregiver, but in the instances over the years where if I've gone out of town for a, baby shower or something, and my husband's been the person watching him at home, we go over all the things and my husband would say, I'm not going to pay attention to his poops. I'm not going to pay attention, just teasing me because he knows how like vigilant I am about making sure he's going.
Well, I actually, when Ava is not in my care, even at her school day, I want to know about seizures, but what I really want to know about is poo. And if some back and forth communication doesn't go on, the one thing that always really irritates me when Ava's outside of my presence is not to know if she has or hasn't, because it is so important and it can snowball so quickly. Having a kid without a tube makes osmosis laxatives like Miralax a little more challenging. You can't force someone to drink water, and if they're not drinking water when they're taking those, they backfire. You can have a real opposite effect. So we tend to always have firm stool, and sometimes I go by the size of Ava's stool. I know it's probably not what people want to hear, but I think a lot of us with kids that eat orally, first and foremost, they don't always chew their food well, may or may not have enough water to make things move. So inevitably, you can end up with stool that is extremely large. And I mean, like show up at the clinic and show the GI team the pictures of the stool you're dealing with. And they're like, oh my God. And they have to call people in to, then in comes all the students and stuff. Look at the pictures that Amanda brought to clinic today. It's our normal,
Yeah. Mega colon, you've said to me before. I don't think that's a term I heard until I heard you say it.
Well, right. Well, I mean, if you're not getting enough water, everything that's going into that colon to come out, your colon will start to reabsorb that water, and things just get harder and bigger. And essentially, what the GI explained to me eventually was their colons get really big. And once that happens, you risk the colon prolapsing when it empties. It's a bad place to be when your colon is compromised. And, some kids with CDKL5 actually have stomas, not for feeding, but for putting laxatives in every day to go poop. Sometimes you end up giving essentially an enema from the top down every day. When Ava was young, she was not diagnosed. I know I say this just so you guys can understand that we were just making decisions very compartmentalized by specialty, and every specialty would blame another specialty for something going on. So, GI might be like, well, it's neuro. And, some of this could be true, but in the early years, we didn't have really a coordinated multidisciplinary team. And I really was still floating around thinking we didn't belong anywhere. And so I didn't really have a pediatrician who was specialized or understood kids like ours. So, I resisted certain things. They put her on Prevacid early. Prevacid actually backfired on us and caused more constipation. It's a PPI. It makes it so you don't have stomach acid at all, and that didn't work for Ava. So I just sort of abandoned things. And within the next year or two, Ava became like a terrible air swallower. And like her stomach would just fill with air. And then the gas can get into your bowel in between your tissue in there and be very uncomfortable. And so we got to a point to where her quality of life from GI problems was not great. That's when I had to get serious about committing to treating something other than seizures and really finding a balance that worked. And nobody wants to change yuck diapers, but it's part of the process of figuring things out. If your child is so blocked up that nothing can get through, they're going to have diarrhea. So diarrhea can also be a sign of constipation. So I think pay attention to poop and have good conversations with, I would even say your primary care, like definitely get GI on track, but I think everybody needs to understand the significance of good bowel health.
When you look at the recommendations for the management of treatment of CDKL5 deficiency disorder, I'll stick those in the show note. When you go to the GI section, it talks about, if you have a kid with this diagnosis, a GI doctor should be a part of your care team. There's no question about it. Like I was saying earlier, sometimes even if you think your kid is pooping every day, you might think everything is okay. We had an example of this is we were seeing a urologist for a separate issue. They did an ultrasound, and the urologist came in and said, "Did you know your child's full of poo?" And that was a real surprise to me because he had been going every day. So I think even when we think things are okay, it's still good to have those conversations with doctors and really share what things are looking like. What size are the bowels? How often are they going?
Take a picture.
Yes. For my son, I don't know, this might feel like too much information to listeners, and I apologize, but when I'm changing his diaper, sometimes I'm spending some extra time wiping because I notice that helps him if he has stool that's ready to go, but it hasn't come out yet, but it's right there, you can see it. Spending some extra time wiping and stimulating the area a little bit will help him to go too. And that seems like normal to me, and maybe it is somewhat normal of a habit for someone with his condition or conditions like his, but I'm not actually 100% sure that I've ever really told the GI doctor that I do that. So, I just think sometimes we get in our own routines of things, and sometimes we don't think about what it means to be a really good reporter to the doctor, to encourage people to really reflect on what's going on with their child's bowel habits and to be that really good reporter.
Yep.
So that your doctor understands what you're dealing with.
Yeah. I mean, I've learned a lot about my own body talking to Ava's providers. Gynecology is a whole nother talk, but we kind of do a protocol, or are supposed to do a protocol with Ava, sort of like a colonoscopy prep, right? I mean, that's essentially what we're doing with all these laxatives all the time anyway. But even though Ava is treated with a stimulant laxative twice a week, she goes every day. I set her on the toilet. She still is, like you said, full of poo. You do an x-ray on her back and you can see where the stool ends in the x-ray. And almost 20 years into this, and I'm still struggle with this aspect of the disease. I still do like gentle stomach massages and a warm bath, like soaking, maybe some Epsom salt, like just trying to get her relaxed, because I think GI stuff is very uncomfortable, and your quality of life, if your stomach is never feeling good, can't be great. I mean, I can hear reflux coming up in the morning. And it still happens every day. I treat Ava with an H2 blocker. So it's not like it's burning, but it still has got to be not comfortable to have stuff creeping up your throat when you get up in the morning. On top of, like, my stomach hurts because I need to go to the bathroom or I'm full of gas. I really think that it's probably as impactful on quality of life as seizures. Some days more so on her quality of life. But I mean, how do you feel about that?
Yeah, I think, whenever our kids are uncomfortable, they're always at risk for increase of seizures. I mean, we see that sometimes when even talking about like UTIs and things. When our kids
Yeah.
are uncomfortable, it can cause problems in a lot of different areas. So we do that too. The gentle, you can look up on YouTube like how to do like a massage, a belly massage, and even warm fluids too. If you have a kid that's tube fed, they can
Put
do warm
something warm.
fluids.
Yep.
Sure. Some of
Yeah.
the things that when we asked our peer caregivers in our Facebook support group for some things that they do, there were a lot of dietary approaches, right? Prune juice, we heard a few times. Sweet tea, someone said. Apple juice, aloe vera juice. Those are some of the fluids that people mentioned as being part of their dietary approach to managing constipation. And then things like flaxseed, kiwi fruit, pears, chia seeds, wheat germ, bran flakes. I know,
fiber.
yeah, the fiber. I used to hear pea a lot. When you read those like infant books, something that starts with a P, pears, prunes, peaches, like P words could get things going. There's actually something that I'm going to put in the show notes that I have not tried myself, but I'm part of a blended diet support group on Facebook. And there's this recipe called the Poopinator that gets passed around quite a bit. And it's different whole foods blended and a protocol for giving that to your tube fed. But I don't see any reason why somebody couldn't drink it or eat it orally too.
I mean, I used to play around with things like MCT oil, and then I thought, well, I'm going to try this MCT oil out myself as well. And MCT oil is effective, but it also can give your tummy some pain. So there's a lot of different things to try. And I also think you have to switch it up. Like, I used to do a lot of probiotics and they sort of stopped working. Don't hesitate trying something different if you don't have your groove and you're not like, we are doing great, like, it's okay to throw in different things, or, maybe switch up what you do by the day. If, Ava won't drink sweet things, otherwise prune juice would be great. She likes iced tea. So I think caffeine in some regards can be helpful for our kids. I don't imagine many of them are drinking caffeinated drinks.
No. But I think, speaking of the probiotics, it's another reason why, some people mentioned in the support group some like supplements that they've purchased online. And it's just another shout out to always talk to your doctor about those kinds of things. Because when we were at a GI appointment and I had mentioned, giving the probiotic, because our pediatrician had recommended doing it after the antibiotics, and how I had continued with the probiotic because it seemed to be helping his constipation. And the GI doctor made a comment about how some people shouldn't be taking probiotics.
Yeah.
And he said who, I couldn't remember, it didn't apply to me, but it triggered me to think, these things that you get over the counter, or even sometimes your dietary, changes. If you have a nutritionist on your team or something, it's always a good idea to touch base with those people about what you're planning on doing.
Yeah.
Because you never know.
When some
They
things don't
might
mix
know
well.
something you don't know. Right.
Yeah.
They very well could know something that you don't know.
Yeah. Over the counter, sure, you can buy it, but is it safe? Well, it kind of depends on what else going on. We don't know how our seizure meds affect our children's gut motility either.
Some of the medicines that people mentioned as working for them were things like Senna, Miralax, milk of magnesia, different suppositories.
Stool softeners. Some people do well with stool softeners. It's a milder approach, but if it works for you.
Yeah. I think our takeaway is these are some things to ask your doctor about.
Yeah, I think CDKL5 comes with GI issues. It is part of the diagnosis. So welcome it when it's time. I don't, early on, I think I see a resistance to people treating GI because they don't recognize it or just don't have the capacity to deal with anything but epilepsy. And I think some good advice is, even if your provider hasn't talked about GI issues, talk with your provider about what you should be looking for and get started early and get in a good habit of monitoring your child's GI the way you monitor their seizures.
When you're new to this diagnosis, you're always hoping that some of the symptom lists that you read isn't going to apply to you. And maybe sometimes you get lucky and it doesn't, but I would say GI is probably not one of the ones where you're going to get lucky.
That is a great way to put it, Marissa. Like, it's like, find a GI doctor. Back where we started, you need to have that person on your team.
Yeah. GI, I think, was the second specialty after neuro that we added to our team when my son was a baby for reflux.
Interesting.
Thanks for chatting about this topic, and hopefully it starts people on good conversations with their providers. If anybody has things that they're thinking about, you can comment on our podcast. You can always send us a message, send us an email. All the information on how to get in touch with us is in our show notes. We'd love to hear from you.
Yeah.
Thanks, Amanda.
You're welcome. And to all of you listening, happy poo to you. You can cut that out.
I'm not going to.
I just say it. People gotta laugh about something.
Oh my gosh.
Thanks for listening. We hope you'll follow us on social media at CDKL5 in color on Instagram, Facebook, and LinkedIn, and visit us online at www.cdkl5incolor.com. Have questions or a topic you'd like us to chat about? Would you like to be a guest on our podcast? Email us cdkl5incolor@gmail.com, and we'll be in touch. Until next time.